Yeah, so part of the challenge of what's happened in Congress is that the true ideology of the Freedom Caucus would actually just repeal the Affordable Care Act. It's very difficult to actually find a legislative vehicle that advances what many Republicans have said they want to accomplish, which is to make healthcare more affordable for people. And still meet that ideological viewpoint that it's actually a market good. And so that's why there's been so much conflict in Congress, particularly in the House, because in the House you have a very large group, about 40 people who are in the Freedom Caucus, who, as I say, really just want to repeal the Affordable Care Act. But then you have an equally large group of moderates who who are in districts where people have benefited from the Affordable Care Act. They are not interested in taking health coverage away from people. That's a very difficult thing to do. And so they don't want to just repeal. What ACA tried to do was try to make both groups happy by putting elements in there that would satisfy the Freedom Caucus and elements in there that would satisfy the moderates. And in the end, it made nobody happy. Interestingly, there was a piece of legislation proposed in the Senate that got attention for a very brief period of time called the Cassidy-Collins bill, and they tried to do exactly that. They kind of had a bill that I would say is take one from column A and one from column B. Their bill was, if you're a state, they wanted to give decision making to the states, and they said, if you are a state and you like the Affordable Care Act, you can keep it exactly as it is. If you're a state who doesn't like the Affordable Care Act, you don't have to have the Affordable Care Act. You can do some other things. You can have a lot of variety in what you do in your state. And if you're a state who kind of likes parts of it or doesn't like other parts of it, we'll give you a little more money. You can adjust that money. You can modify it as you would like to modify it. Now, the challenge, again, with that was they really did try to satisfy all these different constituencies and turn it back to the states within some framework. And the people who are strong advocates for broadened coverage didn't like it. The Democrats generally, but some moderate Republicans too. The people who just want it repealed didn't like it because it kept Affordable Care Act in place in many states, so they didn't like that either. But it's back in discussion now because they're having so much difficulty bridging this ideological divide. I'm finding it very difficult to see what they could actually come out with that would pass both the Senate and the House. You might get something through the House because I think there is a time when the Republicans will say, we promised for 7 years to repeal the Affordable Care Act. We have to do something even if we don't like it. And you might possibly get the moderates on board to say, okay, we know it's going to be stopped in the Senate. Now, the Senate is where the Democrats really have power, right? Because the filibuster is still in effect for legislative issues. And there are, it's a very slim plurality of Republicans in the Senate. They can only afford to lose 2 votes. And so that is really where the Democrats have a lot of power to stop legislation. And we already know there are a couple of moderate Republicans in the Senate who have very serious concerns about what they've heard from the House so far. So right now, I don't see anything that comes out of the House making it through the Senate. But you could get back to the Cassidy-Collins type bill. They could pass something, maybe. It's hard to see, actually, how they get there. Well, first of all, I think the issue of where states in particular fit is very much an underreported issue. States are really going to be crucial to what happens in the future. They're already crucial, but I think there is no question that no matter what happens in Congress, states are going to play a bigger role. And that's the case because so much in the Affordable Care Act was left in the regulatory basket. So the Secretary of Health and Human Services has tremendous discretion. And so it's not just about what Congress does on legislation. It's about what Tom Price, who's currently Secretary of HHS, decides to do, and Seema Verma, who is the head of Centers for Medicare and Medicaid Services. They are already today reaching out to states to say, we want proposals from you, and we want really creative proposals from you. There are provisions in the Affordable Care Act, Section 1332, and also a very long-standing opportunity for states in the Medicaid program to adopt a waiver called 1115 waivers that enable states to go forward to the federal government and say, we want to do some things differently. Here's how we plan to achieve the goals. So right now, the waivers say you still have to achieve the same goals that the Affordable Care Act would achieve, but we want to do it differently. So waiver opportunities are huge. And we know that the administration is encouraging states, as I say, they're actively going out to states today to say, give us your proposals. Many states are really interested. We've seen Wisconsin come forward with saying already they want to require Medicaid recipients to be working in order to get Medicaid. That is something the Obama administration would not have approved previously, but this administration is saying we like those ideas. Give us those kinds of proposals. They're talking about varying who can be included in Medicaid versus on the exchanges. So there are many things that can happen at the state level, and many states and many state legislators today are coming forward with those kinds of ideas. It is really important that we spend collectively some time with states, legislatures in particular, educating them on the Affordable Care Act, on health care more generally, on the principles of insurance, on all the things that are involved, because they become key decision makers. This is a very technical area, it's very complex, and often state legislators don't have a lot of background in these kinds of issues, and so we really need to be spending at least as much time collectively at the state level as being spent at the federal level, because they're going to actually shape how health care is delivered on the ground. I think it is fundamental that citizens be engaged in this debate. And I've had the privilege of doing some town hall meetings with Congresswoman Debbie Dingell, and I am enormously impressed with the citizens who are coming and the questions that they are asking. They want to be informed. I've gotten questions about what exactly is a high-risk pool? How does reinsurance work? What are cost-sharing provisions? How does funding work in the Affordable Care Act? These are fantastic questions from citizens. They're very technical questions, but they're really important to understand how this legislation works and how changes to it can affect consumers. So becoming informed, I think is really important for citizens, showing up at these town halls, asking questions, and really trying to understand these issues. And there are a lot of explainers out there that really do try to make it understandable for citizens. You don't have to become an actuary to understand the really key provisions in this law. So first and foremost, getting educated, understanding what the issues are and what is being debated. Second, it's really important for state legislators as well as congresspeople to know your viewpoints. What do you value? So this issue that we were talking about earlier, in your viewpoint, what are your goals with healthcare? Is it your goal to have more affordable health care, to have choice of hospitals and doctors, to have low premiums, to have low copays and deductibles? What's important to you? What are your values? It's really important for legislators to understand. Are you willing to pay some taxes for those things? You have to express your values in a way that legislators understand what you consider to be a priority. Is it important for your state to have Medicaid as a vibrant program and to deliver services and to have health insurance for most citizens? That is a very important value, and legislators need to understand that value. Other things consumers can do: join coalitions. Legislators do want to hear from you, absolutely. They want to hear particularly from their constituents, people in their district. That's really important. They really do listen, and it's important for consumers to understand that they do listen. But they also listen to coalitions, and sometimes joining forces, adding your voice to other voices, will magnify your voice. It will enable people who might have a little more technical knowledge than you do to speak on your behalf. So identifying who those groups are that might generally represent your viewpoint, joining with those groups, joining with other people so that they can speak to legislators in the state or at the federal level, that will also be important. And last, tell your story. One of the things that has profoundly moved many legislators, many senators, many of the senators who called for a repeal of the Affordable Care Act and are now rethinking that position, were profoundly moved by individuals who told their story about what their life was like when they had a pre-existing condition and could not get health coverage, and then what happened under the Affordable Care Act, which said you have to have coverage if you have a pre-existing condition. You can't be excluded by a health plan. They talked about how it saved their life. They talked about how it enabled them to go back to work. They talked about how they were able then to contribute to the economy of their states. Those stories, many people are collecting those stories, telling your story, being willing to do that. That is powerful as well. So consumers have many ways and many voices and are the most powerful voices in this dialogue and need to be engaged. It's really an important civic responsibility.